Om Shanti. So in this video, I have an opportunity to share with all of you what is Dr. Lajpatrai Mehra Neurotherapy is. So this is called as Neurotherapy, but its full form is Dr. Lajpatrai Mehra Neurotherapy, which is called LMNT. By profession, I am a dentist, and I have surrendered my life in Brahma Kumaris organization since last 2 years. But since last 1 year, I'm also studying and learning this therapy, and I have benefited myself in terms of some problems that like fever or coughing, swelling. So I used this therapy on myself, but at the same time, the intention to learn this therapy was to help others. So I live at the center, Brahma Kumaris Center, and I have an opportunity to help the sisters and brothers with this therapy. So why I want to share this is because it is completely medicine-free treatment. When I started to study this, I heard about it. I didn't believe that is there any therapy where we don't need to use any medicine, any oil, or any instrument. Wherever we are, in whichever clothes we are, we can start this therapy. So the easiness to practice this therapy, it really attracted me. But at the same time, the desire to help others that I'm living with and to serve people around me, that gives me happiness. So I started to learn this, and I have many experiences of helping myself and helping others, from small to the bigger diseases like fever, cold and cough, swelling in the mouth, Parkinson's, digestive system problems, PCOS, PCOD, menstrual cycle related issues, and many more. So as I start to explain this therapy, I want to give an idea about how our body works. Because if we understand how something operates, then it is easier for us to deal with it. Same applies to our body. If we have a general idea about how our body works, it will be easier to understand how this neurotherapy works. And to start with, our body is like a big chemical factory. And no chemical factory or pharmaceutical company in this world can match this factory. We take medicines, we take chemicals from outside to suppress or to cure, to control many symptoms or many diseases. But what if we know the way to naturally activate our body to produce those chemicals and heal our body naturally? Isn't it amazing? So this is how neurotherapy works. If you imagine the body as a big factory, the organs in the body, it's like machines working in this factory. And if you imagine those organs as workers working in the factory, so not just focusing on products, but also focusing on the workers, on the machine, increasing its effectivity, and thereby we can get the best product. So same like that, this neurotherapy works. So we work on each organ. If that particular organ is not well or is not working properly, then there is one or more diseases we will face. So curing the symptoms, but also at the same time, we are also working at the root. We are removing the cause from the root, and thereby we are getting rid of the diseases and also the symptoms related to it. So moving forward, there is a real story that there is a person who has borderline sugar, he has digestive issues, he has increased cholesterol and a blood pressure. These are the problems inside the body. And what are the symptoms? Headache, tiredness, joint and back pain, and many more. And when he goes to the doctor, what happens? That giving the medicine for each problem and referring that patient to the specialist for different problems. But in neurotherapy, what we do, we don't just work on the symptoms. We focus on the organ. There is a diabetic patient, the problem with the pancreas, so we focus on that. And there could be another patient, same, diabetes, but we find that there is problem with the stomach. He has issues with the gas, so we focus on that first. So there could be two patients, same disease, diabetes, but there could be different treatments for both of them. Because we are not just looking at the symptoms and controlling and managing it, but we are also looking at the root from where it is coming, finding it out and starting the therapy. And that's how the whole process works. So modern science, it works on the product. But this therapy, neurotherapy that we call it as, it works on the machine. It works on the efficiency of the machine. It works on the workers, and thereby we are getting the best results. Moving forward. So when we consume anything, for example, if we eat dal and rice, when we consume it, our body doesn't see it as, okay, I'm receiving dal and rice. Anything that we eat, our body digests it in three parts: carbohydrates, fat, and proteins. And then again it is divided in smaller particles. So this process is called the digestion. We ate something, whatever it is, it will divide it in three parts. So first step is consuming the food, second is digesting it, and third is absorption. Whatever our body has digested, the third step is to absorb it, take it in the body and circulate in the body to different organs, to the glands, so that they can work properly. So if you can imagine that from any of these steps, if one step is not working properly, for example, if we eat something, many say I'm consuming healthy food, I'm really being attentive to my regular diet, still I don't know why my body is not accepting it. So our first step was correct, but the second step, the digestion, where it happens? In our stomach. So in neurotherapy, we believe that focusing on that organ, which is stomach, if we increase the blood circulation to that organ, if we maintain the pH of the hydrochloric acid in that stomach, whatever we consume, it will be digested properly. And for your information, that our stomach has hydrochloric acid, which is very essential to digest the food that we eat. And the pH of that hydrochloric acid has to be between 2 or 3. If it is more than that, then anything that we eat, it's not digested properly. So that second step, if the digestion is not good, then the absorption won't take place properly. So in neurotherapy, what we do, we focus on stomach, we decrease the pH of hydrochloric acid, we increase the blood circulation to the stomach with different methods that I'm going to share in a short time. So now the digestion is okay. The raw material was in, that is consuming the food. Then we worked on the machine, that is stomach. Now the digestion system is okay, moving forward to absorption. That is another system. Now, if the food is not digested properly, intestines won't be able to absorb anything from it. So it will be excreted via stool or urine. If digestion is okay and food is moving forward in intestines, what intestines do, it absorbs the food, the minerals and vitamins and all other nutrients from that digested food, takes it into the blood, and then what happens? That blood circulates throughout the body. So all our organs like liver, gallbladder, even brain, different glands, adrenal glands, thyroid gland, there are many organs and glands in the body. So that circulating blood will reach there and it will give that nutrition to those particular organs so that it can work properly. So now we can connect how we can cure the disease, working on the root, working on each organ. And if any organ is cured, and if we focus on that organ, if we work on that, if we increase the blood circulation, if we stimulate that organ will start to work properly. In this example, the stomach and intestines. For example, if the intestines are inflamed, then absorption won't take properly. So deficiency of vitamins and minerals in our body, the root cause is digestion. So this is how it works. In the same way, if we find out that there is problem with the liver, we focus on liver. There are many diseases connected with the liver like metabolism, detoxification of the body, storage of vitamins, and many other things. So you can imagine if one organ is not working properly, many diseases are connected with that. Right? So the most invaluable gift of neurotherapy is the concept of focusing on organ and not just diseases. So we don't just want to control or manage the disease with pills and medications, but we also want to work at the root level and heal our body naturally. So moving forward, the whole process is like a disease cascade. You know how no disease can happen overnight, and there is no cure for any diseases overnight. If we want to heal it naturally, then we have to have the passion. So if we want to heal our body naturally and we want to get rid of the diseases, we have to have some patience. But this neurotherapy for like acute diseases, sometimes it has instant results. But for chronic diseases, if we maintain the consistency and if we do it properly, then we can get amazing results. There are many chronic diseases which are cured by neurotherapy. Now moving forward, it is said that 3 systems in the body, the abdomen, kidneys and lungs, if these 3 organs work properly, it is impossible for anyone to get a disease. So abdomen consists of intestine, stomach, liver, which has functions in digesting and absorbing the food, and lungs and kidneys. What kidneys do? It filters, it detoxes, it regulates blood pressure, and lungs, it maintains the acid-base balance. So if these 3 systems work properly, if someone is ill, if they have symptoms, for example, of diabetes, of blood pressure, if we work at the root level, it can get amazing results just by removing those causes. So talking about this therapy and how it was invented. So as the name mentions, Dr. Lajpatrai Mehra, neurotherapy, he is the one who invented it. And his intentions were so elevated that he wanted to use this therapy for the service purpose, to help others. And not putting a barrier that only a medical professional can practice this. But he wanted to teach this to even those people who are not from the medical profession, but they can learn this, they can apply this for themselves and also help their family members. even those who want to pursue this for as their profession, he also gave this opportunity to many and trained many. Years of studying medical physiology books and anatomy, he read it many times. And when you read or study this book, even I have studied it, and I reference it with that medical book because I have also studied it in my dental career. So it really gave me that confidence that this is a very scientific method. And when I related or connected everything, every point or therapy that was mentioned in this neurotherapy book, when I connected it with the scientific base, it really gave me a confidence and gave me a clear idea. So now, moving forward, this neurotherapy works in 3 ways. First, we increase the circulation to the particular organ. And how do we do it? So there are some reflex points in our body, which is usually located between knee and the ankle, or on the thigh area, on forearms, and on hands. So what we do, we apply 6-second pressure. And not so much pressure that someone cannot bear the pressure, but we can apply the pressure until someone can tolerate it. And 80 to 90% of this therapy is given by others to the patient. But there are also some self-treatment points that we can do for ourselves. But the best results are there when we give it to others or when we get the treatment for others. So as I mentioned, the first way is increasing the blood circulation to the particular organ. So for example, if we want to stimulate the liver, what we do, there is a point on the left thigh and left forearm. So simultaneously we apply the pressure as it is mentioned. So every treatment, every formula, we give a particular number that how many times we have to do that point. Usually it's only a 6-second pressure. And for example, if we want to stimulate the liver, we press that reflex point and release that pressure after 6 seconds. What happens in that 6 seconds? When we press that, then blood flow is stopped. And then when we release it, that blood flow is increased to 150 to 300%. And that liver or that particular organ starts to function properly or better than before. And it is medically proven that that 6-second pressure is ideal. And if we increase that pressure beyond 6 seconds, then tissue necrosis starts to happen. So there is a depth into that. But this is how in neurotherapy we apply 6-second pressure, and that's how we increase the circulation to the particular organ. Second way, we control or we regulate the chemical imbalance that is created in the body. So how this chemical imbalance or hormone imbalance has occurred? So as I mentioned, if blood is not circulating properly, blood volume is low, then what happens? Each organ or gland in the body is not receiving that blood properly. So it won't work properly. For example, thyroid gland, it releases some hormones, but if that particular organ is not receiving the blood supply properly, then what will happen? The muscles around it will be loose. And what will happen? That particular gland, that thyroid gland, is releasing T3 and T4 hormones, so it won't produce those hormones eventually. Then what happens? The diseases or problems related to thyroid gland, right? And where it started? From the step we eat some food, and digestion and absorption. So it all starts from there. So the second way is to maintain that chemical imbalance which has happened in the body. We know many diseases which is related to hormonal imbalance. PCOD, PCOS, there are many diseases which is connected to this imbalance. So what we do in neurotherapy, we naturally activate that organ and say that, okay, now you have to work properly. We stimulate that organ. We didn't know the way how to naturally stimulate our body organs before. But now we know that. An amazing thing is there are no side effects. So when that particular gland or organ starts to work, then what happens? That chemical imbalance that was occurred in the body, it starts to level up. So that was the second way. Third way, stimulating the nervous system. There are many nerves, pair of nerves from the spinal cord, which regulates many activities in the body and the brain. We have central nervous system and also peripheral nervous system. So we have the way to stimulate or activate those nerve fibers, those nerves. And when we stimulate that nerve, what happens? Every nerve innervates different organs or different parts of the body, and it has its function. So when we stimulate those nerves, what happens? It also has an effect on that particular action or the body part, so it starts to work. For example, there is 10th cranial nerve, which has an effect on the full digestive system. So when we stimulate it, what happens? As soon as we stimulate the 10th nerve, hydrochloric acid in the stomach, the pH reduces instantly and our food starts to digest. So it has an effect on the whole digestive system. So as soon as we stimulate, it starts to work. So these are the three ways the neurotherapy works. I personally have cured many problems, because when we study something new, we also want to experiment. Coming from the medical profession, initially I didn't believe, but as I started to do it, I felt that why somebody didn't tell me this before. And I really enjoyed studying this. So this is the full explanation of how it works. So when somebody asks me that I don't have a time, it takes some effort, because manually we have to perform some points or therapies. So initially it needs some practice to learn those points, and I feel that there shouldn't be any barrier to practice this therapy or to learn this therapy, even if you are not from the medical profession. I have many contacts who are learning this and helping people just by learning this therapy, and they have benefited many people. There is a helpline number which is given in this video, and there is a YouTube channel link which is also shared with you. So if you have any queries related to this, you can always ask calling this number, and also you can check many videos online. There is also a WhatsApp community that you can join to learn and to be connected with the future events or future webinars which is going to happen. So there are no quick remedies for anything, but yes, there are basic tips that we always share with people. But if there are diseases which is happening, but if there are chronic diseases, long-term diseases, and if you are expecting that, okay, share this point with me, show me the therapy points and I'll be treated. No, it is not like that. For chronic diseases, for complicated problems, we always need an appointment. As we go to the doctor, what happens? We take the history, we ask everything, what medicines are that patient is taking, what surgeries has been done. So we all take all that history, and then we come to the point that what therapy that patient needs. And then we guide that patient. So, but yes, there are also some quick points that we can help ourselves with, and I have also used it for myself and also taught that to many. But for chronic problems, we always need an appointment. Okay. Om Shanti.